Patient and healthcare provider engagement is crucial for quality of care, but sometimes healthcare runs into inconsistent quality as well as gaps in care and access. With EHR, there is a hope that physician efficiency and quality of patient care may improve. Electronic health records, also known as EHR, are collections of patient information embedded in network-connected systems that can be shared across different healthcare settings. However, the records must be integrated in a way that is convenient for use amongst other parts of a healthcare organization. Oftentimes, electronic records are not integrated and they are recorded in silo systems, which each have their own way of login and patient identification. Without integration, professionals in different healthcare settings would have incomplete picture of the patient's health status because the use of data silos isolates the information from different parts of the organization. This may result in some disparities in the system, such as semantic variation and inability to share data across systems. Although there may be some complications, EHR can be improved upon if the disparities are addressed. Also, preservation of health records becomes a worry as the length of time to store EHRs is unknown, but a proposed solution concerning trusted notary archives that can store data in an XML format is able to prove the integrity of stored data. And this time invariant method allows for future systems to access and use the information. In all, EHR provides a way to comprehensively look at patient health status. However, although EHR has made an impact on the clinical setting, it still needs some improvements, such as integration, in order to improve workflow.
There are 6 components that interact with the EHR system with varying degrees of integration. The first is administrative system components that can be thought of as the core of EHRs from their utilization of unique patient identifiers, known as MPIs or Master Patient Index. The second component is laboratory information systems, of which many are not well integrated, as numerous diagnostic machines with their own interfaces make integration difficult. RIS, or Radiology Information Systems, use picture archiving communication systems and are more commonly well integrated into EHR systems. Fourth are pharmacy system components that have found increasing integration with the decline of re-entry of pharmacy orders. Computerized physician order entries have demonstrated a decrease in medication-related errors, yet the net effects can be to actually slow clinicians. Finally, clinical documentation may offer potential benefits like saving up to 24% of nurses' time, but again requires greater integration to be really beneficial. Overall, what I have taken away from this section is that integration is vital for the full benefits of a comprehensive EHR system to be realized. As of yet, this accomplishment has not been achieved, and I believe that for this feat to happen, the needs of health systems, health workers, and patients must all be reconciled. Perhaps following the model demonstrated by the World Wide Web Consortium, the international organization that is responsible for establishing standards for the internet, should be followed. A national body that standardizes EHR systems may be helpful in developing a comprehensive EHR system for health systems both small and large.
In 2016 article from MedCity News, Leapfrog has conducted a survey and found out there were 39% of incorrect potentially fatal drug orders and 13% of potentially fatal orders that failed to send alerts in 2015. This is a very tricky topic because there's no threshold on how many alerts is too little or too many. With too many alerts, it can lead to alert fatigue, and people will actually stop responding to these potentially life-saving alerts. Although CPOE has made tremendous improvements since it was first introduced as a standard equipment in the medical field, it is not without flaws. Many of the flaws are centered around human behaviors and human-computer interaction. For example, inexperienced users will take a long time trying to put in the orders, or even make mistakes because of the complexity of the software. Poor usability plays a big role in many medical mistakes, which can turn fatal if not noticed. In addition, some automated parts of the software can cause the user to become careless when maneuvering because it causes a sense of false security that the computer will catch a mistake anyway. But overall, CPOE has made getting prescriptions and care easier for the patients and improved the flow of the process by putting a check on man-made mistakes.
Although electronic health records is an important and useful tool that can improve quality of care by sharing important health information across providers, one key idea that needs to be addressed is privacy. Now, the article mentions how privacy is still upheld because nations set up guidelines for these electronic health record systems. Now, with such a massive database of patient and doctor information, a data breach on any scale could pose a serious threat. Now, this is an important topic to emphasize because this is still personal information, and you don't want just anyone to be able to see it. Now, I believe electronic health records is an efficient and useful tool that all providers should implement. So they should stay connected and provide quality care, but I also think that there needs to be considerable effort put in place to prevent any data breach of any kind.
EHR continuously grows, there are two main components in which the future of EHR relies. There's the issue of semantic linking and the issue of larger companies needing to realize that there's an emerging market in EHR, as well as standardizing the industry. Because smaller companies are starting to become noticed and purchased by several larger companies, I believe there should be a focus on the semantic linking of EHR. One issue that can arise with semantic linking is the issue of linking past data to future data and present data, because as time progresses, jargon changes. In order to increase the efficiency of implementing machine learning for semantic linking is to produce platforms for healthcare providers that implement industry-standardized jargon, so that as soon as new data is implemented, the terminology is instantaneously linked. By doing this, machine learning scientists can focus on making code robust for a finite amount of time rather than